Good afternoon and welcome to our 100th COVID-19 update for the town of Plymouth. I'm Steve Triffletti, a Plymouth Town Moderator, and we have been here each Wednesday. This will be our last show that is planned, and it's being brought to you live by PAC TV. You can tape it on Comcast Channel 15 and Verizon Channel 47. It can also be watched on PAC TV's streaming channel by going to pactv.org/live. Today, for questions of our panel, and we have a real Brady Bunch number of panelists, you can go to PlymouthInfo@pactv.org. These forums are replayed at pactv.org/Plymouth. Today's participants joining Ken Tavares, Matt Muratore, and me include Michelle Bratty, Director of Elder Affairs for the town of Plymouth; Melissa Arrighi, she is the Plymouth Town Manager; Amy Naples, the Executive Director of Plymouth Area Chamber of Commerce; Dr. Christopher Campbell, he is the Superintendent of Plymouth Public Schools; and Timothy Cruz, he is the District Attorney for Plymouth County; Dr. Barry Potfin, he is the Chair of the Board of Health; and Dr. Philip Trafletti, and he is an attending primary care physician. And we're going to go, as we have for the past 99 shows, and go to Ken Tavares, who is the immediate past chair of the Select Board for the town of Plymouth. Ken, you've been with us throughout this, and did you think this would be happening in May, show number 100?
No, Steve, I didn't. As a matter of fact, I've been reflecting on everything since we started the program, and I think how naive we were. I thought initially that by 4th of July of last year, the virus would have come and gone. Little did any of us realize what we were in for. But I do think that the town has pulled together and worked hard to make a difference in the lives of our citizens. Folks have asked me a few times as to, what do I think about what's happened and the impact that it's going to have on the town. And I have carried with me in my town folder, which is now retired, since March 16th, the words of Kitty O'Meara, who talked about the virus. And I have read this piece every day at the beginning or the close of the day. And this is what I want to leave for those that have been watching us faithfully for the last 100 shows. The words to me are so important. We are not done with the virus. And in the last paragraph of Kitty's words, she gives us, some work to do. So, together, as I have said so many times over the last 15 months, we will defeat this virus, but we need to stay together with or without a program as such as this. So I'm going to read and beg your patience as I read Kitty's words. And the people stayed home and read books and listened and rested and exercised and made art and played games and learned new ways of being and were still and listened more deeply. Some meditated, some prayed, some danced, some met their shadows, and the people began to think differently. And the people healed. And in the absence of people living in ignorant, dangerous, mindless, and heartless ways, the earth began to heal. And when the danger passed and the people joined together again, they grieved their losses and made new choices and dreamed new images and created new ways to live and heal the earth fully as they had been healed. Thank you.
Thank you. And that's Kenneth Tavares. He's the immediate past chair of the Select Board for the town of Plymouth. He and the other panelists answer your questions at PlymouthInfo@pactv.org. Early on, when we started these presentations, we knew that we needed to follow the science. And in our case, it's follow the science and follow the medicine. And so we began our presentations with people in the area of science and medicine. And joining us once again today, Dr. Philip Trafletti. He is an attending primary care physician for Beth Israel Deaconess, also my brother. Hi, Phil.
Good afternoon, Steve. Here I am in the broadcast from your office. It's a pleasure to be here today. as you had asked, I'm going to start with where we were a year ago. I remember there was no personal protective equipment really. The stores were, not much of an inventory at the hospital. I actually had to donate most of the personal protective equipment and swabs and things I had to the hospital. The hospital was desperate early on in the pandemic. We didn't have the PCR tests at the beginning. It took a while to get that up and running. We didn't really have any medications to treat coronavirus. And so that was a problem. And of course, we had no vaccine. So when everything started, things were somewhat bleak. I have a patient who's a professor at Harvard, and he is in the Kennedy School of Government, and his specialty area is China. And so he told me back in February last year, 2020, he said he was absolutely certain, the experts he talked to, that it was going to spread globally. And so I was already bracing for it in February. I went to my last public event at the hospital on March the 5th, and we were still there without masks. We had a buffet that we shared, but some of my colleagues wouldn't shake my hand already. They wanted to do the elbow bump instead. So I was already starting to do that. And then I remember my staff being very afraid of, we would screen patients before they would come to the office to make sure they weren't sick and they weren't spreading the virus. And even myself, being a physician, I definitely had a sense of some personal vulnerability where we didn't have a lot of equipment and we didn't for testing or protection, et cetera. It certainly was a difficult time. But, as time passed, we started to get much, much better, learn to wear masks, socially distance, learn, use the good hygiene, hand washing, et cetera. And fortunately for myself, my staff, most of my patients all did extremely well during the early phase of the pandemic. Where we are right now, things are totally different. We have plenty of that personal protective equipment. I think our inventory in stores are excellent, both in my office, at the hospital. Obviously there's an abundance of masks that people can, buy commercially. There's plenty of testing with the PCR tests to test for COVID, and the availability of that has been great. The accuracy is terrific. And now we have some medications. We have Regeneron, which is what President Trump took when he got sick. It's for mildly ill people who don't need to be hospitalized to try to prevent them from getting sicker. And then, of course, we have remdesivir for inpatients in the hospital who are sick with COVID. And we also have a dexamethasone steroid for very, very sick patients in the hospital. So we have a few medicines. But by far, the biggest grand slam was the development of the vaccines. And to have all the vaccines that we've had, and to have now 50% of the United States, fully vaccinated adults is just incredible. And so, as you know, if you're doubly vaccinated, that comes with privileges in life. Like I can go to my great nephew's birthday party this weekend. So that's my first 2 minutes, and I'll be around to help tie things up later. Thanks for having me today.
Thank you, Dr. Philip Triffletti, an attending primary care physician at Beth Israel Deaconess. He's here in Plymouth today, actually at my office, coming to you by Zoom. And at this time, we continue on with our medical portion, and we welcome back Dr. Barry Potfin. He is a professor emeritus from Yeshiva University, Department of Biology. He's an epidemiologist. Welcome, Barry.
Yes, thanks, Steve. So there's not going to be any graphs or tables or charts today. For those that missed them, we'll be doing that on the Board of Health meeting that starts at 4 o'clock this afternoon with a lot more information. But I just wanted to concentrate on vaccines briefly today. Plymouth has done very well. In terms of one or more doses, it's gotten to 61.5% of the people over 20 years of age here in Plymouth, compared to 61.7% or so in the US. And fully vaccinated, we're at 49.7 compared to 50% in the US. There are things we could improve. Looking at the 12 to 15-year-old groups, Plymouth has 9% of them now vaccinated. In Massachusetts, it's 16%, and in the US, it's 14%. So we have a ways to go. In terms of dividing things up by men versus women, women are doing better than men. So come on, guys, get with it. For a 1+ dose, it's 51% of the men and 59% of the women. And for fully vaccinated individuals, it's only 39% of the men here in Plymouth, and 48, that's for Massachusetts, and 48% for women. So I just also want to mention there are a few places we can still get the vaccines. There's 3 CVSs here in Plymouth that are doing it. The Walmart is doing it. The Walgreens is doing it. And hopefully soon the Kingston collection site will open. They're going to have evening and afternoon and weekend hours that they'll be using. Also, there's still free COVID stop the spread testing going on. And the one place you can get that in Plymouth is Walgreens. So there's a lot of other stuff to talk about. I'm going to save that all until later on this afternoon. Please feel free to zoom in on that if you want to hear about it. Thanks, Steve.
Thank you, Dr. Barry Potfin. And every other week, we were also often joined by Sarah Cloud, Beth Israel Deaconess, Director of Behavioral Health, also Dr. Mark Wilson, an epidemiologist, and many other people. And we had many regional representatives, including our very own Plymouth County District Attorney, Timothy Cruz. Welcome, Tim.
Welcome. Can you hear me?
We can hear you, Tim. And Tim,
Great.
Have things forever changed either in your office or in the courts in which you practice?
I think that's a pretty fair statement, Steve. Obviously, things have been incredibly different, but we've had to continue and persevere as best as we can, working with the trial courts and working with the day-to-day situations. It was very, as we all know, very fluid. Things would change. Sometimes we'd get different edicts from the trial court from 9 o'clock in the morning till noontime to the end of the day. And I think that's always been a challenge in trying to make sure we can keep our cases going forward, making sure that we can keep people safe as best as we can. And we continue to try to do that. I just want to say at the outset, Steve, I wanted to thank you and Matt and Ken and PAC TV for doing this. I think this is a great program to let people know that, life is still going on and there is certainly life before the pandemic. And what we're going to be dealing with now as we continue to work our way into the end of it and what it will be like after that. I think we've been so incredibly fortunate here in our county to have the relatively new courthouse down in Plymouth. It's really been a godsend because it's one of the few ones that were actually able to do jury trials here in the Commonwealth. Some of the counties here in Massachusetts, Berkshire, Norfolk, they're not using their courthouses because they're not safe, they're not sound, they're not COVID-free, and they've had incredible challenges. Norfolk's doing their jury trials in Lombardo's and Randolph. And I know down the Cape, they're using the Cape Cod down in Hyannis, which is a restaurant. But we're so very lucky here to be doing our jury trials in Plymouth, both district court and superior court. I think that's been very effective and it's helped us quite a bit. We continue to be doing our grand jury practice here in Brockton, but it's different. We've moved, the grand jury no longer sits in the basement of the building. They sit actually in courtrooms now that we're using in lieu of using the court trials there now. So we've been able to do that. The challenges are ongoing. COVID did not stop crime. It did not stop the terrible drug epidemic that's continuing to go on here in the Commonwealth of Massachusetts or here in the county of Plymouth. Just this month, we indicted a man on manslaughter charges who had allegedly supplied fentanyl to a woman who fatally overdosed there in Plymouth. So we continue to do that. Our Children's Advocacy Center has been dealing with issues of the kids who are physically or sexually abused in our county. And although our numbers were down, I think a lot of that was because the kids weren't going to school and they weren't seeing mandated reporting. Now that schools are up and running again, I think we're going to continue to see those numbers go up to where they were, and that we need to continue to help these children and make sure that the kids who are at risk are getting the help that they need and that maybe they haven't gotten as much as because they weren't physically in school. I want to congratulate Plymouth. The town of Plymouth has been a great partner for us dealing with trauma-sensitive schools that we're trying to get all of our schools in our county up and running, and that we've been training schools and we've trained Plymouth and the schools and the police and trying to get those at-risk kids to trauma-sensitive schools to help them to stop the cycles that they're dealing with and also to make sure that we can continue to keep them out so that we're not dealing with, unfortunately, prosecuting these cycles of generational crime that we see sometimes of kids whose parents were in the system and now they're in the system. How do you keep them out? How do you make sure you can do your job? So we continue to do all that. And at the same time, we've been doing all sorts of Zoom training for our staff because the science doesn't change and the law doesn't change. We have to make sure that we're up on top of what's going on as best as we can as we go from step to step. So I'm very appreciative of things that we've done. I'll finish up in the last 2 minutes as we continue to go out and about and deal with our issues for our seniors and for our children. But I want to thank everybody for all their efforts during this. I think because of the fact that everybody has worked together, I think that's made a really big difference. I want to thank you all for your commitment to the community.
Thank you. And that's Plymouth County District Attorney Timothy Cruz. He is representative of our regional partners, and we had many this past year joining us. Plymouth County Sheriff Joseph McDonald, Plymouth County Register of Deeds John Buckley, Plymouth County Register of Probate Matthew McDonough, Clerk Magistrate of the District Court Adam Bailey. But right now, we're going to go back to the local town of Plymouth, and we welcome back our town manager, Melissa Arrighi. Melissa, when we started this, you had many of your department heads, many of your staff come on. It was a way to communicate to our residents as to what was changing in Plymouth as a response to the pandemic. What do you think?
Well, I think I'm really grateful that we're at the position that we're at now. Every year I write an annual report, and it's sort of a year in review of what's happened. And this year, when you look at it, it's so vastly different than it's been in the past because of the pandemic. This episode, and I'm happy to be on it because it really reminds me that it is this culmination of so many people's efforts and how much communication and outreach was trying to be done to all our citizens. We started out with shock and fear, and now we're at a point of hope and optimism. And I'm just incredibly grateful to be there. Tuesday, March 17th of 2020, St. Patrick's Day, that really marked a milestone for me as the town manager, because that's the day, that many of us never ever saw coming. We actually started shutting down, and we did shut down regular service provision to our citizens. That alone was shocking because we know that couldn't occur. So we had to quickly scramble in order to figure out and rally on how we were going to give those government operations, those critical services to our citizens here. And although we monitored all the statistical data, and every single person on this panel and those who aren't here were helping us look at all that statistical data, and that alone was incomprehensible and honestly petrifying. But it was the anecdotal stories that I think, for me, those experiences from the residents and that I had personally, that were the most heartbreaking. Our residents losing people they loved, our medical providers being overwhelmed and exhausted, and our ability to care, to protect, to cure, it was stretched really thin. So I think as I look back at all of that, our scramble to continue to provide the critical government services, the way our first responders and people in the field reacted, our partners with our state delegation, all of that led to where we are at this moment. I want to personally thank our police, our fire, our hospitals, and even such our building department, our senior center, and our finance department for being able to continue to operate throughout that. Our employees did a terrific job, and overall, I feel that we're at a great place now, but like a former Chairman Tavares said, we have to continue to be vigilant and careful.
Thank you, Melissa Arrighi. She is the town manager of the town of Plymouth, and her anecdotes remind me that where I was on Sunday, March 15th. I was at a local restaurant, and I recall that the governor had come on and announced the shutdown for St. Patrick's Day, and the server came back to the table, and she was sobbing. So we've certainly come a long way with the delivery of information, which I believe has provided comfort to people. Now, Dr. Christopher Campbell, you are superintendent of Plymouth Public Schools. You weren't at the time we began this show, and then you were kind of thrown into the middle of this when Dr. Gary Maestas retired. What's been your experience?
How to capture this in 2 minutes or less, but thank you, Steve, for inviting me to be a part of your final episode, and thank you for putting this show together. You know, sort of reflecting, putting on my teaching hat for a moment, I thought it would be fitting to quote Dr. Seuss, who once wrote, "When something bad happens, you have three choices. You can either let it define you, let it destroy you, or you can let it strengthen you." So reflecting on this first year, you said, you know, after 13 years serving in the Plymouth Public Schools and 28 years in education, I've learned a lot of lessons. However, nothing over the years has made me reflect more than serving as a superintendent during a pandemic. As the school year draws to a close, I think it's a fitting time to reflect on what we've learned about education and schooling over the past year. It's hard to capture a pandemic's worth of lessons in 2 minutes or less. So I'm going to comment on a few of them. First, our schools must learn to continuously transform themselves. So when the pandemic first struck and our schools were closed March 13th, our educators had to really reinvent school in record time. Without warning, our teachers went from engaging their students in the classroom to logging on to Google Meets and mastering a number of online platforms in a matter of days. It was really incredible. Teachers were tested like never before. So our schools, when they began to reopen in the fall, once again, out-of-box thinking and ingenuity were really needed to operate our schools. So not every idea was successful, but our schools continue to pivot, reinvent themselves to really best meet students' needs. So creativity and improvisation were completely on display throughout this entire year. So we need to embrace change. We need to be willing to take risks and fail. That our students look up to their teachers as role models. And when teachers are able to open up, show resilience, take risks, fail publicly, they create a safe space for their classrooms, for their students to do the same. Another lesson, technology is now a basic classroom need for all students. The unequal access to technology and the internet was concerns for our district long before COVID-19. I think the pandemic has made it entirely clear to the entire country that many communities, our own included, would have a hard time making remote school work unless this digital divide was addressed. And I'm happy that we've done that. We're now one-to-one. So, but having said that, while the pandemic has certainly highlighted that digital divide and need to eradicate it for us, technology will never replace a teacher. There's no doubt that technology should be a basic right, but this year has proven repeatedly that teachers bring about change that no technology can. And then if I were to spend my last 30 seconds sort of reflecting, I'd say that relationships are critical. When schools closed last spring, students lost access to a world of interactions and connections with peers and adults. And this isolation was really hard on many students. Many of them lost motivation to participate in class. Mental health struggles, as we've talked about many times, worsened. So the lack of FaceTime made it really hard to identify students and families who needed help. So once again, we learn, and we need to continue to learn to engage our families in creative and new ways like we did this year. We have to stop engaging families the same old way if we want different outcomes. So if we're going to do anything well, we have to continue to prioritize genuine relationships with all our students and families and our entire community whenever and however possible. So relationships really matter the most. So, reflecting on the past 15 months, I like to say, let's not let this pandemic define us, but let's encourage the past year to really, refine us and refine our work. So thank you, Steve.
Thank you, Dr. Christopher Campbell. He is Superintendent of Plymouth Public Schools, and thanks to all of his administrators and other staff people who participated throughout the year. In addition to providing a segment on medicine and for the town and for education, we were very concerned about our seniors. They were particularly hard hit with this pandemic, and we often invited people to talk about our seniors, in particular, Michelle Bratty. She is the Director of Elder Affairs for the town of Plymouth. Welcome back, Michelle.
Thank you, Steve. PAC TV and fellow panelists, what a journey this has been. Well, flashback to March 2020. I was a fairly new director with a little less than 9 months in the position when the pandemic hit. I remember thinking to myself, I don't believe that there is a training manual for this one. But in hindsight, there was, and it was called Human Compassion, subtitle Teamwork. As we know, seniors were hit hardest in every way, from both the medical and isolation standpoint. The Cal mission didn't change. We simply had to reinvent how we achieved it and work around the barriers that existed to do so. We were closed, but we were ready to go. And the Cal team didn't disappoint. I dare say they excelled. So what have we done from then until now with the closed facility? Well, 8,300 birthday calls, 6,200 wellness calls, 200 director calls, distributed 3,500 grab and go meals, 44,500 meals on wheels. This is reading like a partridge in a pear tree. Our social outreach team handled 4,700 calls, booked vaccine appointments for approximately 500 seniors. Our volunteers logged 6,000 hours. We ran 305 programs, put on 2 senior parades, enacted 1 Town of Plymouth Select Board proclamation recognizing every September 15th as Senior Appreciation Day in our town, received a large donation for our COVID work in the community from Eastern Bank Foundation, and won first place nationally by the NCOA in partnership with PAC TV, Duxbury, Kingston, and Pembroke for our PAC TV Senior TV Guide, programming created exclusively for senior viewing during the pandemic. Oh, and created a documentary with PAC TV on senior resiliency through the pandemic, but that's a stay tuned coming soon situation. The important point is, why do we do what we do during this pandemic? What happened? Because we mean what we say and we say what we mean. None of the above was for us. It was and always will be for our seniors. Pandemic or not, our mission is to serve the seniors of this town and do so giving 110% with class, dignity, and respect. We also shed approximately 11,000 tears along the way. That's 1,000 for each Cal staff person, because we also lost many beloved Cal seniors during this time, and we are still mourning these losses. This panel became a lifeline, in many cases a literal one, for our seniors in the darkest of days, and provided critical information. And personally, along with the Cal staff, we are indebted to PAC TV, Steve, Ken, and Matt for the opportunity to be part of this panel. Thank you.
Thank you, Michelle Bratty. She is Director of Elder Affairs for the town of Plymouth. And throughout the year, we were also joined by Robert Eisenstein, who is a senior living planner, and also Cheryl Botieri. But now we're going to go to what has been our business segment, because we also knew that in dealing with the pandemic, we had to pay attention to our business community. And here with us often, Executive Director, Plymouth Area Chamber of Commerce, Amy Naples. Amy, have we made it?
We have. I like to think so. First off, I think it's so hard to believe this is the 100th episode. And I just want to say it's been an honor being a panelist on the show. I have to tell you, I'm so appreciative of the opportunities this program has lent and the exposure it gave our small business community. Huge congratulations to you, Steve, Matt, Ken, and all of the panelists that joined the program. And certainly, of course, Julie Thompson and her amazing team at PAC TV. It sure has been an amazing run. PAC TV has certainly gone above and beyond for our community, as well as the chamber, and I cannot extend my appreciation enough and my sincere thank yous. To move into the business update, it is quite promising. We're seeing lots of positive trends for our small businesses, and the SBA just reported that the job growth rate in small businesses has increased significantly since April. The NFIB Small Business Optimism Index rose 2.4 points in March to 98.2. So we are seeing optimism, which is so great. Reports that people are starting new ventures. Entrepreneurship is on the rise. Certainly, I think that lends to the unemployment and seeing people creating and starting their own businesses. And lastly, there are still so many programs that are available to aid small businesses through the SBA and other opportunities and grants. So that is very optimistic and promising as well. Since it is the last COVID update and I'm the biggest small business cheerleader, I thought I would dedicate some time to recognize our small businesses and the wonderful continuous support our community gave them. The business owners in Plymouth here have worked so hard. They have truly put their blood, sweat, and many, many tears into their business, but they made it. They really have, and we are so proud of them. I know our entire panel and community is behind them, cheering them on, and we see great success for all of them. This weekend, we are celebrating a very big milestone with them, certainly with the restrictions ending and reopening fully. We think it's going to be an amazing kickoff to summer, the unofficial start of summer, and the season ahead. But of course, I have to give my ask that our community continues to support them however possible. I do want to recognize one small business owner who is just simply amazing, giving and caring. Holly Ewell from Flair Floral, which is located in Village Landing, is that special business owner. Today, we asked Holly to provide some floral arrangements for the luncheon, and without hesitation, Holly was happy to do so. This isn't the first time Holly has said yes without hesitation and kind of stepped up to the plate. Holly has brought flowers to our local nursing homes and hospitals to cheer up the seniors and patients. And we know flowers bring so much joy to us and to those folks. Holly works hard as a small business owner, and being a florist during the pandemic was obviously incredibly difficult with the lack of events, weddings, and celebrations. But despite the loss of revenue, she continued to give to the community that she loves and is truly a wonderful and kind person. So not only is she just that wonderful, but her arrangements are absolutely beautiful and stunning as well. She, though, is just one of the many stories of the amazing business owners we have in our community that always are willing and able to step up. And of course, we are there to support them. The Chamber is, of course, always working on creative and fun events, including our in-person networking events and festivals. So we are excited to see you all in person and enjoy our beautiful town and all it has to offer. So Steve, thank you as always for allowing me to provide the final business update today.
Thank you, and that's Amy Naples. She's the Executive Director, Plymouth Area Chamber of Commerce. Throughout the year, we were joined by many people leading the business community. Bob Nolette from Amy's office, Maria Leva from the Canal Chamber, Stephen Cole from the Plymouth Regional Economic Development Foundation, Lee Filson from C. Plymouth, and many more. And in our very first presentation, this guy that you're going to see on the screen, Plymouth State Representative Matthew Muratore, was there right from the start. Now, Matt, did you anticipate that you would be back here 100 shows later?
No, especially after the November election, I was surprised I was reelected again, but that's a whole other story. But no, Steve, I never thought we'd be here during COVID for this long. I think we knew when we first met, Steve, as you remember, you and I, Ken, met with Michelle Pecoraro and Dr. Gary Maestas on March 14, 2020. And we sat around that table at PAC TV. We shot that show with Julie Thompson in the studio, and none of us had masks on. And the declaration from the governor was already made the day before. So we never thought at that point how drastic this would get for our society, not just us, but the entire world. As Michelle said about a lifeline, I think it was Michelle that said the lifeline. This whole thing was a lifeline for me personally, and I'm sure for a lot of people, because you sat there and you didn't know what to do. None of us knew what to do. There's no playbook. As many times as we as legislators have been criticized and the governor's been criticized for things, there was no playbook for this. And I tell people that all the time. So we were going along doing the best we can using data and not dates. And I think that did us well here in the Commonwealth by using data and not dates. And I think people have now understand looking back, because there was no playbook and using the data and not dates, that it has worked out very well. We are number one in the country for giving out vaccines. Right now, I'm going to give you just some quick numbers, Steve. We have administered 7.6 million vaccines in the Commonwealth to date. 4.1 million are first vaccines, or 3.2 are second vaccines, and 240,000 J&J. So there's 3.5 million people that are fully vaccinated in the Commonwealth right now, with our goal of 4.1. So you'll see by early June, we will be hitting that 4.1 million mark and exceeding that. With the COVID cases too, we are now at 660,000 confirmed cases since this pandemic started in March, with 17,475 deaths. Again, over 60% of them came in long-term care facilities. Yesterday was the second straight day, though, that we had cases under 200 since September of 2020. We also have hospitalizations below 250 cases now, with 74 in the ICU and only 40 folks that are on ventilators. And the total case activity, as I've been talking about for several weeks, that's been tens of thousands of active cases over the last several months is now below 10,000. We're at 9,000 and still dropping. So active cases have gone way down, vaccinations have gone way up, which is why on this Saturday, the 29th of May, that the governor is lifting all these restrictions and, pretty much getting back to where we need to be, except in some cases like healthcare facilities and childcare centers and things like that. But more to come on that as the governor does extend the emergency declaration to June 15th when it expires. But he is going to be filing legislation and we'll be in session next week to debate this. He's looking to extend outdoor dining through November 29th. He's looking to do the temporary suspension of open meeting law requirements through September 1st. And also looking to some other things like billing providers, not billing folks for COVID-related illnesses from providers. So some more things to come over the next couple of weeks, but you won't be able to watch it here. But you can check out my Twitter and Facebook page, and you can also check everything online from Old Colony Memorial and wherever else that you get your news from. But you'll be seeing some additional information on this. And just one quick thing, I want to thank all the guests as well. PAC TV, I've said it a number of times, they've been true heroes in this whole thing. And all the guests that have come on to really help us all understand, not just the viewers that have been watching us, but all of us that have been participating in this and getting through this together. It felt like we were doing as a team and not individually, and I appreciate that. And Steve, I appreciate what you've done to pull us all together, lead us in this, and particularly Ken too, for working side by side. And we talk about this all the time. We're proven here in this community that it doesn't matter if you're a Republican or Democrat. Ken's a Democrat and Republican. It doesn't matter. We love this community, and we'll do anything for it.
Thank you, Plymouth State Representative Matthew Muratore. Thank you for all of your help and support throughout this past year. Usually at this time, we'll be talking about who would be coming on next week. But since that won't happen, I will give you a little tease and let you know that I have some very special guests coming at the close of the show, because in my own family 1 year ago today, several members of my family were in the hospital, but more about that later. Also, the credits at the end will give tribute to more than 100 guest panelists throughout the past year for the 100 shows, as well as all of the many people at PAC TV who helped make this possible. But at this time, we're going to go back to our panel and hear their closing thoughts. And as we began earlier with our panel, we're going to continue with Dr. Philip Trafletti. He is an attending primary care physician at Beth Israel Deaconess, and he is here with us today. Phil, what else do you have for us as we complete this presentation?
Thanks, Steve. So first of all, I talked about where we were, then I said where we are, and now, of course, where are we going with this pandemic going forward? I do think that we'll still be using masks. Like, as you know, now we're still using in healthcare settings, other congregate settings, nursing homes, prisons, et cetera, transportation. And I think going forward, you'll probably still see the use of masks in different ways, maybe not all in those same settings, but, using masks really is a good hygiene measure. I think the Asians have figured this out many years ago from all their influenza epidemics that they've had there in Asia, that, we were able to almost eliminate influenza in this country this year because we wore masks and washed our hands, et cetera, et cetera. So I think there will be a place, and hopefully people will, have learned how to take better care of themselves and others with good hygiene for masks and hand washing, et cetera. So I think some of that hopefully will stick. I think handshaking as a greeting is coming back, will come back. I've noticed a lot of my patients already are extending an open hand, and I'm willing to accept that. I'm in the habit of using my elbow, but I think I can move to using my hand and feel comfortable about that. But I do think you'll see people go back to handshaking as a greeting. The vaccines, as I've mentioned on the program many times, I am a big supporter of there being mandates. I'm thrilled that most of the universities in New England will be requiring it for their students, and many of them also for their staffs. I'm hoping that the businesses will be looking at this carefully for their own staff as well as for customers at businesses. I think it's terrific if we can get everybody vaccinated. I found it very curious that there's been all kinds of incentives you can get beer, you can get lottery tickets, you can get paid to get the vaccine. I wish that happened when I got my vaccine. I would like to have gotten all those things, but there could be other incentives coming along. And then I think one of our really big challenges as a country is, thinking globally. I'm thrilled President Biden is thinking about this with his administration. How are we going to control the pandemic globally and supply vaccines to others around the globe to help stop the pandemic? So far, so good on the variants, and I'm looking ahead. I think for a good period of time, we can expect these vaccines will, hold true and prevent infection. And I do think, we've got great technology to build these vaccines, the messenger RNA platforms with Moderna and Pfizer. If we need to make a new vaccine because there's a variant that's not responding to the current vaccine, I think we can do that, relatively quickly, much more quickly than we did with the first vaccine. So a lot of great things, I think, coming forward, in terms of controlling the pandemic and trying to end it. This, unfortunately, there's been, tremendous costs from this pandemic, economic costs, human costs. Just think of all the people that have died. I'm sure everybody here probably knows somebody who was affected and was either suffered death from COVID-19 or, severe disability from it. It's a very serious thing. A lot of patients, some of the studies showed that people died because they didn't come in for their heart attacks or their strokes, or they avoided their cancer screenings. We'll be totaling up these things over time, but there were a lot of other impacts from having the pandemic. And, certainly as, Chris mentioned, the superintendent, as well as Michelle, the terrible problems with isolation. People couldn't gather with their families to celebrate things or to celebrate even deaths and have normal wakes, those kinds of things. So, I see a lot of these things improving as time goes on. Sadly, one of my patients died during the pandemic, nobody from COVID, but one patient from suicide. And I think that just goes to show, how devastating. We've talked a lot about the mental health impacts of this, the isolation and the pandemic, but I see a lot of these things, getting much, much better. I think this community of Plymouth has done an incredible job coordinating efforts with public health, with schools, with businesses, with local and state government to achieve great control, great vaccination rates. So I congratulate everybody here on the program and everybody in the community for the great work that they've done. I do think it's important to stay active. And, during the pandemic, I did a lot of things, just try to keep myself busy. So I didn't feel depressed in any way. I just looked for openings, whatever I could do, I did. So I did a lot more outdoor activities, golf, skiing, etc. I think, a lot of good things are going to happen. Like, for instance, today at Pine Hills, I got a hole in one. That's a good thing, right? That's for Matt. Early on in the pandemic, I was talking about how important it is to enjoy your life and not to just count the days. Don't just count the days, but make every day count. And that is my final message for our 100th broadcast is, make sure you make every day count as you go along in life. Thanks, Steve.
At this time, we're going to go to Dr. Barry Potfin. And Barry, last week on our show, you told us we could now have fun. Is that still true?
Absolutely, it's still true. And I think it's going to stay true for the foreseeable future, we all hope. Anyway, I just wanted to say that this has really been an exercise in teamwork. It's been a lot of teamwork. There's more than one team involved in this. What I've been able to do, I certainly would have difficulty doing if it weren't for Karen Keene and her office staff, especially Margaret. So shout outs to them. Mark Wilson has been on the show. We've had conversations about topics related to COVID. And I have to also mention how grateful I am for the Vice Chair of the Board of Health, Mr. Jerry Levine, who was our go-to person for coordinating with the reopening committee. He's worked extremely hard and certainly grateful for him as well. But there's been so many dedicated, wonderful participants in these 100 COVID update shows. It's been an honor and a privilege to play a role in disseminating the reliable fact-based information to the community. We certainly couldn't have done this without PAC TV, and certainly Steve's efforts as a moderator of these shows, and especially shout out to Matt and to Ken Tavares, because they barely ever missed one of these shows. I want to personally thank Ken for his patience with me, because we get into some pretty long conversations, and he's provided unmitigated support at all times for what we do. I want to close just by saying that it's times like we've been through in these past 15 months that really bring out to you that you're proud of Plymouth, and you're certainly wonderfully proud also of everybody that you have found to work with you on this. It's a great place to live. It's a great place to work. And I think we're all very fortunate to have all these wonderful people available, working so hard with all of us to make all of this possible and to get through this as intact as we possibly could. Thank you, Steve.
Thank you, Dr. Barry Potfin. He is the chair of the Plymouth Board of Health. And as he mentioned, we're grateful also to Karen Keene, who's participated on the show. She's the director of public health. Also, past chair Brigitte Keene participated along with Dr. Kenneth Turkelson. So we've had many people joining us. And at this time, we're going to go back to Plymouth County District Attorney Tim Cruz. And Tim, I know a lot of that with which you deal is not hopeful or happy, but are there things in your world as Office of the District Attorney that gives you some cause for some optimism going forward?
Thanks, Tim. No, absolutely. I think we have to be optimistic. And I think it's programs like this and these difficult times like we're undergoing right now that gives me hope when you see people working together, and trying to make sure the right thing happens. I mean, look at the group of people you have here, from business to towns to the state house, medical, dealing with seniors and dealing with children through the education. You look at the challenges that we've faced and how we've come out in the other end. I'm incredibly optimistic about, the future and what it holds for everybody. From our end, like I said, in the DA's office, we continue to work through this. We've worked through the pandemic. There's been no rules, like I think Matt said, and you just try to figure out as best as you can. And now that we're proceeding through, and I hear about the good things coming, whether it be restaurants opening up again in different fashions and different capacities down in Plymouth and throughout our county, it gives me hope that, we're going to continue to get through this. And people should understand that from the DA's role, and you're right, lots of the things we deal with here are usually, if you see me, it's something really bad. But I'm so glad to be involved in something that's really good, and getting information out of the great things that we do here and the challenges that we face. As was just stated, we're facing more challenges as a result of the pandemic, but it gives me hope that we're all working together and we're going to get through this. So, thank you for all of your efforts. Thank you for all being here and giving words really to people in the community, the people that may be down as we deal and continue to deal with the mental health issues in our community, opioid epidemics, the pandemic itself, all the challenges that we face. But people should know that we have really good people who are working really hard every day, making a difference in everybody's lives. And that's what it's all about. And I think that's what you have to go through the darkest times to find the light at the end of the tunnel. And I think that we see some light right now. So let's proceed from there. We'll continue to be safe. And thank you all for your efforts.
Thank you, Plymouth County District Attorney Timothy Cruz. And we return back to Melissa Arrighi. She is the town manager. Melissa, in this past year, we didn't have a playbook. You and I worked together and put together not 1, 2, but 3 remote town meetings, something never been done before in the town of Plymouth. And you have a large staff, many employees. How did you do it?
Well, I think we're taking away a lot of, I really would say, benchmarks and lessons from what has gone on over the past 15 months. Virtual town meeting, virtual meetings, expanded open meeting law, using WATD, using PAC TV that we've heard about so much today, using more social platforms. Not only did I think the employees react well in order to continue the services, but I have to give some credit to the citizens, because that wasn't an easy change for them. And although we all met some resistance, I think that they adapted tremendously. And for that, I'm appreciative. I think some of the other things that the staff and then is the town manager and Chairman Tavares, many of us take away from this is that these essential partnerships that we've always had, but that really, we worked so closely throughout this, that those partnerships have been solidified in a way that we would not have otherwise seen with BID Plymouth, with our DA's office, with different boards and committees. Certainly, I've never worked this closely with the Board of Health, with our state delegation, who we always partner with, but this was on a daily basis. So I think that it's important, Brewster Ambulance, I think it's important to our schools to continue to move that forward, because there are so many other things that we can collaborate on, and it was successful. I also think that this fear, the isolation that has been discussed today and throughout the show, and I liked earlier when one of the panelists said that we are forever changed. We have to all work together on how we're going to address that, because I'm seeing, and we are all seeing, short-term effects from that. And we know there'll be longer term ones, both in the children and in the adults and the friends and the neighbors that we see all the time. So I think that we're going to have to find ways as a government and as a community to work through those. And those can't be put in our rearview mirror. And finally, recovery for our businesses, as Amy always talks about, we have to continue to address that as we look for new paths to be able to help them and support them in everything we do. So I'm going to close by thanking Matt, Ken, and Steve for having me on the show, thanking our citizens, all the town and school employees, our kids, our children, and our leaders and businesses, that although they are changed, we have managed, we have collaborated, we have shared and persevered. And for that, I'm very proud and grateful.
Melissa Arrighi, she is the Plymouth Town Manager, and another major partner, as she's mentioned, are the public schools. Dr. Christopher Campbell. I've always appreciated, having been a past chair of the school committee, how important schools are to the community. And this year, more than ever, we became aware it affected businesses who had employees who had children that were home because they couldn't go to the school building. So many changes. What are we looking at going forward?
Geez, many changes, but I think just as you said, Steve, just the outpouring of support in this community, as Melissa said, just working together, I think is critically important. So I just want to take this final moment to express my sincere appreciation for so many people, as DA Cruz referenced, and I've said on this show many times, it's through our darkest times that we tend to see the goodwill of our community. And I've seen it time and time and time again over the course of this year. And I am so appreciative for that. So I want to thank our entire faculty and staff and our administrators for their commitment to our students. None of this would have been possible without them. There would not have been any school if it weren't for their tremendous support. So thank you to them. Thank you to our school nurses for keeping our students and our staff healthy and safe all year. Their impact has been profound, and I've greatly, greatly appreciated their support. A special thank you to our students and our families for their patience and their understanding and their support. Our students and families continued all year to face challenges, but face these challenges with great courage and resilience and support. And that support and understanding has been so greatly appreciated by me especially. And I'd like to thank our community partners and our volunteers, whether it was organizing a team of volunteers to support our meal distribution efforts, donating thousands of bags to help us deliver food, or delivering Chromebooks to over 2,000 families when we shut down our schools. Our community has always been there for us in our time of needs. Thank you to our Board of Health and our Director of Public Health for just tremendous value in their expertise, their collaboration, tremendous support. As Melissa said, I certainly never envisioned getting to know our Board of Health and our Public Health Director as I have, but I'm so fortunate to have them as a partner and their efforts to maintain our schools' safety and staff wellness has been just so greatly appreciated. Thanks to our town leadership for your amazing support throughout this past year. I'm truly grateful for our town leadership, our elected officials for the support they've shown not only this year, but in the 13 years that I've been here. And thank you to the school committee too for their countless hours and days that they've spent with me, with my administrative team in this community to prepare our schools for return. It's not been an easy year on any of us, and their commitment to our students has been inspiring, and I'm really internally grateful for that support. And then just lastly, Steve, I just want to thank you for providing this program for our community and bringing us all together like this. I have greatly personally appreciated this opportunity to speak and share information through the program. So thank you for allowing the school department to take part in providing our community this venue to educate our community on what's going on. So as I've said before, these circumstances this year seem to have evolved on a weekly, if not a daily basis at times throughout the year. So we wouldn't have been nearly as successful if it weren't for the collective support of the entire community. So I just want to thank you all and thank this community for just tremendous support. So thank you, Steve.
Thank you, Dr. Christopher Campbell. He is Superintendent of Plymouth Public Schools. And as we leave conversation about our children, we go back to our seniors. Michelle Bratti, Director of Elder Affairs. Will the Center for Active Living become more active?
Oh, Steve, yes. Fast forward. We survived and now we will thrive. That was a really good segue. That was my first line. So thank you for that. But speaking of thank yous, I just would like to publicly thank former Select Chair Ken Tavares, who was the Center for Active Living's committee liaison. Over this past 15 months, Ken sat in on every advisory board meeting that we had at Cal. And the mantra I heard from Ken, from our town manager, from our select board, and our town administrators, always, what do you need and what can we do to help? We have been extremely supported at Cal. And I want to thank Ken for his dedication to Cal since I've known him. So thank you so much. And to our town manager and our select board for their ongoing, unwavering support. But Cal, we had a unique opportunity, over this time to connect with area businesses, municipal departments, and community leaders in ways that we hadn't previously. We intend to take full advantage of these new partnerships to bring our seniors the very best opportunities. We're reopening our doors slowly but safely and are excited for future Cal events and introducing innovative programming. We're kicking off celebrating our reunion with a brand new outdoor summer concert series at Cal on June 29th. We have a cornhole tournament, cornhole, against the town of Duxbury for town bragging rights. And it will feature an unexpected team right here on this panel. That would be myself and the town manager. So save the date. That will be on June 30th at the library at 1:00. Come cheer us on. The winner gets town bragging rights, and you know how we Plymouthians roll. We like to win. The 100th episode may be coming to a close, but the community commitment shown by this panel is just warming up. Stay tuned, Plymouth seniors. We're about to have some fun. Thank you, Steve.
Thank you, Michelle Bratti. She's Director of Elder Affairs. Amy Naples, Executive Director of Plymouth Area Chamber of Commerce. We have been supporting businesses, and everyone on this panel, as we wrap up, will be leaving and going to support a local business. Are we ready to move forward?
You bet we are, of course. I've been ready for a long time, and I know our businesses have been too. And I have to say they've done an incredible job at abiding by the guidelines and assuring everyone's safety and all of their patrons. So I would say yes, absolutely. We're looking forward to gathering with everybody today as well. Certainly it's been a hard and incredible, challenging year, but I think there's so many positive things that happened because of the pandemic. I now view challenge as an opportunity to get better, smarter, stronger. There's so much more the chamber can do. We certainly shifted gears. I was pushed out of my comfort zone completely. I put my neck out there probably more than I ever would have before. And of course, we overall operated differently. However, I am so glad that it forced us to do this, because it certainly strengthened our communication with the business community and our relationships with them. And although the sentiment has been stated by all the panelists, I truly feel the best outcome was the strong communication, the collaboration, and the partnerships the pandemic created with all the organizational partners in town, certainly the town, Melissa and the select board. Honestly, every organization came together for the love of our community, for all that we know and do. So I think that is just amazing. We'd always worked together, but I don't think to this extent. So, and certainly they lent their support, advice, and just so much. I was able to lean on them in so many ways during the pandemic. So we truly came together as a community to aid. And I think overall we fared very well in regards to our local businesses. And I think we're poised for a very strong, fast recovery. As always, even though the show is coming to an end, if I can be of any assistance, my door is always open, and I welcome anyone to stop by the Chamber office at 100 Armstrong Road in the Plymouth Industrial Park anytime to chat. And of course, you can stay up to date on all the Chamber's happenings, because we have so much that's going to be happening, by following us on Facebook or Instagram, or you can sign up for our emails by visiting our website, plymouthchamber.com. I just want to, again, congratulate you all, and thank you for all you do. I do have so much hope and optimism, and I'm looking forward to our continued work together. Thank you, Steve.
Thank you, Amy Naples, Executive Director, Plymouth Area Chamber of Commerce. Plymouth State Representative Matthew Muratore, this may be the final episode of our update, but it is not the end for you. You have some further programming coming up. Is that right?
Yeah, Steve, State Matters has resumed. It's a show I've been doing for actually 10 years. I started when I was a selectman today in Plymouth, and changed it to State Matters when I became a state rep. And we're doing an hour special taping tomorrow with you and Ken and Michelle Pecoraro and Gary Maestas with Julie Thompson as co-host as a sort of a wrap up to the 100th COVID show. We're going to do an hour special on that. And it's really just going to reminisce and talk about where we've been, what we've done, and, maybe some funny stories, some sad stories, but it should be fun. So, and that will be airing very shortly after Memorial Day. So take a look out for that. I think, Stephen, in hearing everyone, first of all, I want to appreciate everything every one of you have done, and all these other guests. You've brought so much to the table. It has meant so much to this community and to me personally. I do a lot of management training throughout the years. And one of the things I talk about is an ACT. Attitude plus communication equals teamwork. And that's exactly what we've done. We've all come with a difficult task, one of the most difficult tasks we've ever had to deal with. But we had a positive attitude about it. Said, okay, how are we going to tackle it? And we were open and honest with our communication with each other, and we worked as a team, ACT, ACT. And I'm so proud that we've been able to do that as a community, no matter if you're in government, or if you're in schools, or if you're in business, whatever. I do want to give a great shout out to Dr. Barry Potfin, though, the chair of the board, who came in halfway through this. He was on the board, but then came in halfway through to become chair, and was really a champion and the one that really, told us how it was and what we needed to do. And sometimes it was difficult to hear. Sometimes, the board had to make decisions that were difficult from the state perspective, but they were the right decisions. So we really appreciate Barry and the board and Karen Keene for all they've done. And again, I can't say enough about PAC TV and what they've done. In wrapping this up, Steve, I think, this is like 9/11. This is something we should never forget. We can't forget all the healthcare workers, the grocery store workers. And my fear is that we've already started doing that. The teachers and everyone that really became essential in our society when most of us, were able to stay home and work from home. But there were people out there putting their lives on the line. And we can never forget, the 151 people that lost their lives in the town of Plymouth. So in wrapping up my PCA, I've been told that the PCA I've done the last couple of weeks, Steve, has been a little bit on the negative side. So I'm actually going to do a little bit positive and say, get the vax, and then you can relax. Thanks, Steve.
Thank you, Matt.
It's been an honor to be
Very
on the show.
nice. Thank you. And thanks to all the members of our panel, Dr. Philip Triffletti, Dr. Barry Potfin, Timothy Cruz, our district attorney, and the town manager, Melissa Arrighi. Also, we thank Dr. Christopher Campbell, Michelle Bratti, and Amy Naples. Thanks again to Ken Tavares, who's coming back here once again for his closing statement. Ken.
Thank you, Steve. I could reflect on every one of the prior speakers and agree with everything that was said in the thank yous. I am so proud of this community and how we handled the virus. Many difficult decisions were made. As a matter of fact, as I reflect back, we would, whether it was business, the town, or medical, we would make decisions and within an hour had to change them. And I think the most difficult part was that nothing was etched in stone, and we had to move and move fast. And I am thankful for everyone that's been on the program with us in the last 15 months and what they've done. This was not easy. I would wake up in the morning and say, dear God, please help us do the right things for the right reasons. And most of the time that worked out. We lost, and I don't want to forget, we lost 151 citizens. That more of them went before their time. Our thoughts are with the families. I also think that we need to reflect on that change is the constant. And we have to be prepared even in the months ahead for what we're going to have to do. I look back on the past 15 months and say, we are the new pilgrims, and together we're going to take Plymouth from where it is and bring it into another glorious 400 years. Thank you.
Ken, and we're going to go to a Brady Bunch shot of all of the panelists today, and we're going to move on now with our final closing for our 100th episode. Thanks, Ken. And on a personal note, during this past year, we mourn the loss of those who have passed this life due to COVID-19. And we want to continue to offer our support to those who are challenged by the pandemic. But we also have blessings to recognize and celebrate. And in studio here with me today is my son Franklin, his fiance Emily. And Emily, why don't you tell us a little bit about where you were 1 year ago today?
Well, 1 year ago, I was in the hospital, and we had just had this little guy, and it was tough because we couldn't have any visitors with the pandemic. But it's been a really wonderful and adventurous year, full of blessings, including and most of all this guy. And we're just so thrilled to hopefully be on the approaching the end of this thing.
Thank you. And that is Stephen Peter Trafletti, affectionately known as Steep. Mm-hmm. And earlier this month, he welcomed a cousin. She is Everett Danielle Rosen Trafletti, affectionately known as Rhett. And even though we've had over a year of the pandemic, we in our family have had opportunities to celebrate and enjoy new adventures. And we wish that all for all of you as well, as this is the final 100th episode of the Plymouth COVID-19 update. Thank you for joining us. Thanks for all who have supported us. And good day. I'm Steve Triffletti, Plymouth Town Moderator.